You've trusted doctors all your life, but after 70, there are screenings that may be doing more harm than good. Imagine sitting in a crowded clinic, the fluorescent lights humming, a nurse handing you a slip that says annual checkup while you feel perfectly fine. Do you really need that colonoscopy you've been getting every 10 years or the blood sugar test that started when you were 30? Stay with me, because the next 5 tests might be silently draining the health you've worked so hard to protect. What if the very checkup meant to keep you safe is actually accelerating the decline you fear? Think about it for a moment. If this is resonating with you, give the video a like now. It tells the algorithm we're on the right track. I'm Dr. Laura Martinez, a geriatric physician with 20 years of experience helping seniors live longer, healthier lives. In today's video, we'll uncover 5 common health screenings that after the age of 70 can actually increase risk rather than reduce it. But first, let's understand why the rules that served us well in our 40s and 50s start to change once we cross the 70-year threshold. Our bodies are not the same machines they were a decade ago. Kidney filtration slows, immune response becomes less robust, and the walls of our organs thicken or thin in ways that alter how we react to invasive procedures. That's why the principle of screening benefit versus harm ratio becomes crucial. Guidelines from the United States Preventive Services Task Force and the American Geriatric Society now recommend de-intensification for many tests once we're in our 70s. In other words, more isn't always better. By the end of this video, you'll know exactly which 5 tests to reconsider and what safer alternatives you can discuss with your doctor. Comment below with the last screening you had. I'll be checking the replies and answering the most common concerns in my next Q&A. Let's dive into the first screening that many of us still cling to, the routine colonoscopy every 10 years. A colonoscopy is designed to catch colorectal cancer early, and it has saved countless lives for people in their 50s and 60s. But after 70, the balance shifts. Your colon wall becomes more fragile, making the procedure riskier. Perforation, severe bleeding, and complications from anesthesia rise sharply in this age group. Even more concerning, the likelihood of finding a small benign polyp that would never become dangerous is higher, leading to unnecessary surgeries that can impair bowel function and quality of life. Why keep poking a wall that's already proven sturdy? If you've had a clean colonoscopy in the past 10 years and you're over 70, discuss stopping the test with your physician. A non-invasive stool DNA test can serve as a safer surveillance option, detecting DNA markers of cancer without the need for an invasive scope. That simple switch could spare you weeks of recovery and a whole lot of anxiety. Now let's move on to the second test that most of us have been told to repeat annually, the prostate-specific antigen, or PSA blood test. For decades, men have been told that a yearly PSA can catch prostate cancer early. However, after 70, the story changes dramatically. Many prostate cancers discovered at this age are indolent. They grow so slowly they would never cause symptoms in a natural lifespan. Yet once detected, they often lead to aggressive treatments like surgery or radiation, which carry risks of urinary incontinence, erectile dysfunction, and even cardiovascular strain. Think about it. Are you willing to trade a few months of urinary inconvenience for a cancer that might never have affected you? If you're over 70 and have had stable PSA levels for years, consider asking your doctor whether you can pause the annual test. Active surveillance, where the doctor simply monitors the situation without immediate intervention, is a far gentler approach for low-risk cases. The third screening many seniors still undergo is the routine fasting blood glucose test, often performed every year to monitor for diabetes. In younger adults, catching high glucose early can prevent heart disease and kidney damage. But after 70, the picture isn't so clear. Tight glucose control can increase the risk of hypoglycemia, which in turn raises the chance of falls, fractures, and even heart rhythm disturbances. Your body's ability to regulate glucose naturally wanes, and the stress of fasting can cause more harm than the benefit of a slightly lower number on the lab report. So should you stop checking your sugar altogether? Not necessarily. Instead, discuss with your doctor a more relaxed target range that reflects the reality of aging bodies. A random glucose check or an HbA1c test done less frequently can give a useful picture without the stress of fasting. Choosing a gentler monitoring plan can keep you safe from the dangers of low blood sugar while still keeping diabetes in check. These 3 examples already illustrate a powerful truth. More testing does not always equal better health. When we're over 70, the goal shifts from aggressive detection to preserving quality of life and avoiding iatrogenic harm. If this insight is opening your eyes, hit that subscribe button. We have 2 more screenings to explore that could be impacting you right now. Before we continue, I'd love to hear from you. What's the last screening you had and how did it make you feel? Leave a comment below. Your experience could help others decide what's best for their own health journey. Now let's look at the fourth test that often flies under the radar, the routine chest x-ray performed annually to screen for lung issues. For smokers in their 40s and 50s, a yearly x-ray can spot early changes that might lead to cancer or chronic disease. But after 70, especially for former smokers who have quit decades ago, the probability of finding a clinically significant abnormality drops dramatically, while the cumulative radiation exposure adds a small but real risk of inducing malignancy over time. Why expose yourself to radiation when the odds of catching a treatable lung cancer are so low? If you're a former smoker who quit more than 10 years ago and have had clear scans for the past several years, consider asking your doctor if the annual x-ray is still necessary. A low-dose CT scan can be reserved for those with recent symptoms or a strong family history, reducing unnecessary radiation for the majority. Finally, we arrive at the fifth and perhaps most controversial screening, the routine vitamin D blood test. Many of us have been told to check our vitamin D levels yearly, especially because deficiency can lead to bone loss and falls. However, after 70, the body's response to supplementation changes. High doses can cause calcium buildup in the arteries, increasing cardiovascular risk, and the test often triggers a cascade of supplements that may not be needed. Do you really need to chase a number that could be pushing you toward a different health problem? If you've been consistently within a normal range and maintain a balanced diet with some sunlight exposure, discuss with your doctor whether less frequent testing is appropriate. Sometimes focusing on functional outcomes like maintaining strength and balance is a smarter strategy than chasing lab values. We've covered 5 common screenings that after 70 may do more harm than good. Understanding the shift from aggressive detection to protective preservation is key to navigating senior health wisely. If you found this information valuable, give the video a thumbs up and share it with friends who might benefit. Remember, the best health decisions are made with knowledge, not fear. Stay tuned for the next segment where we'll discuss how to talk to your doctor about de-intensifying these tests and explore lifestyle tweaks that support longevity without over-medicalizing your life. But before we dive into the conversation about how to bring these concerns to your physician, let's pause for a moment and ask ourselves a simple question. Why do we keep reaching for the same tests year after year, even when the evidence tells us they may no longer be serving us? The answer, my friends, often lies in habit, in the reassuring glow of a lab report, and in the deep-rooted belief that more information is always better. Yet the paradox of modern medicine is that sometimes too much information can cloud the path to true wellness. Now imagine you are sitting across from your doctor, the familiar white-coated figure who has guided you through countless appointments. You have a list of tests you've been told are routine, but you also have a growing awareness that some of those routine checks might be doing more harm than good. How do you shift that dialogue from a one-sided prescription to a collaborative decision? The first step is to frame the conversation around goals, not just numbers. Start by sharing your personal health priorities. Perhaps you value staying active enough to garden, to travel, to dance at family gatherings, or maybe you are focused on preserving your independence, on avoiding hospital admissions, on maintaining cognitive sharpness. When you articulate those goals, you give your doctor a compass that points toward the most meaningful outcomes. Then gently introduce the specific tests you're reconsidering. You might say, I read that after 70, routine colonoscopies can increase the risk of complications, and I'm wondering if we could explore a less invasive option. Notice how you are not rejecting the test outright. You are inviting a discussion. Ask open-ended questions that invite your doctor to explain the balance of benefits and harms. For example, can you help me understand how the potential benefits of an annual PSA screening compare with the risks of overdiagnosis at my age? Or what does the latest evidence say about the value of a yearly vitamin D level check for someone with a balanced diet and regular sunlight exposure? These questions signal that you are engaged, that you respect the expertise, but that you also want the decision to be grounded in current science rather than tradition alone. It can also be helpful to bring a brief summary of the latest guidelines. The United States Preventive Services Task Force, for instance, now recommends that routine screening for certain cancers be individualized after 70, taking into account life expectancy, overall health, and personal preferences. While you don't need to recite the entire guideline, mentioning that you've read about a shift toward de-intensification shows you've done your homework and are ready for a partnership. If your physician expresses uncertainty, suggest a shared decision-making tool. Many hospitals now offer printable decision aids that lay out the pros and cons in plain language, often accompanied by visual scales that illustrate the magnitude of potential outcomes. You can ask, do we have a decision aid for colon cancer screening that we could review together? This not only empowers you, but also provides a structured way for the clinician to discuss nuanced risks without feeling pressured. And remember, the conversation does not have to end in a single appointment. It's perfectly reasonable to say, I'd like to think about this and maybe schedule a follow-up to revisit the plan. This gives you time to process the information, perhaps discuss it with family members, and return with a clearer sense of what you truly want. Now let's transition from the clinical realm to the everyday habits that can support a healthier, more resilient life after 70 without relying on an endless cascade of lab work. The first pillar is movement. Research consistently shows that regular, moderate intensity activity, think brisk walking, gentle cycling, water aerobics, helps preserve muscle mass, improves cardiovascular function, and even sharpens cognition. The key is consistency, not intensity. Aim for at least 30 minutes of activity most days of the week, broken into manageable segments if needed. Even a short garden stroll can count. Second, nutrition. As we age, our metabolism slows and our bodies become more efficient at extracting nutrients from food. This means that a diet rich in whole, minimally processed foods, colorful vegetables, lean proteins, healthy fats, and whole grains can provide the essential vitamins and minerals without the need for excessive supplementation. Focus on foods naturally high in calcium and vitamin D, such as leafy greens, fortified plant milks, and fatty fish, while also ensuring adequate protein intake to support muscle maintenance. If you're considering supplements, ask your doctor to check whether you truly need them based on your dietary intake and blood work rather than taking them preemptively. Third, sleep hygiene. Quality sleep becomes more elusive as the years go by, yet it remains a cornerstone of immune function, memory consolidation, and metabolic balance. Establish a calming bedtime routine. Keep the bedroom cool and dark, and limit caffeine intake in the late afternoon. If you find yourself waking frequently during the night, consider gentle stretching or breathing exercises before bed rather than reaching for a sleeping pill without a proper evaluation. Fourth, social engagement. Loneliness and social isolation have been linked to higher rates of cardiovascular disease, depression, and even mortality. Stay connected with friends, family, and community groups. Whether it's a weekly book club, a volunteer opportunity, or a regular video call with grandchildren, those interactions provide emotional support and mental stimulation that no lab test can replicate. Fifth, mental resilience. Cognitive health can be nurtured through lifelong learning, puzzles, and activities that challenge the brain. Learning a new language, picking up an instrument, or even mastering a new recipe can create new neural pathways. Combine this with mindfulness practices such as meditation, deep breathing, or Tai Chi to reduce stress, which in turn lowers inflammatory markers that may contribute to chronic disease. Now let's bring these lifestyle pillars together with the concept of preventive stewardship. The idea is simple. We focus our preventive efforts on interventions that have a proven high-impact benefit for longevity and quality of life while stepping back from low-yield tests that may cause anxiety, unnecessary procedures, or financial strain. Think of it as pruning a garden. You remove the weeds that choke the healthy plants, allowing the strongest stems to flourish. When you discuss de-intensifying screenings with your doctor, you can also ask about alternative monitoring strategies that align with this stewardship approach. For colon health, a stool-based DNA test performed every 3 years can be a gentler surveillance method. For prostate health, monitoring symptoms rather than routine PSA levels may be sufficient, especially if you have no urinary complaints. For bone health, a clinical risk assessment tool combined with a single bone density scan every 2 years can guide treatment without overtesting. And for vitamin D, a once-yearly check may be all that's needed if you're not on high-dose supplements. It's also valuable to keep a simple health journal. Record your daily activity, meals, sleep quality, mood, and any new symptoms. Over time, patterns emerge that can inform both you and your clinician about what is truly changing in your health. This narrative data often proves more actionable than a snapshot lab value taken in isolation. Before we wrap up, let's address a common worry. What if I miss something important by skipping a test? The truth is, the probability of detecting a life-threatening condition that would meaningfully alter your treatment plan diminishes as life expectancy shortens. The medical community now emphasizes time to benefit, the period required for a screening to translate into a survival advantage. For many tests after 70, that time exceeds the average remaining years of life for most individuals, meaning the potential benefit never materializes while the risks remain immediate. So how do you decide? Reflect on your personal health trajectory. If you are robust, active, and free from major chronic illnesses, you may still benefit from certain targeted screenings. If you have multiple comorbidities, limited mobility, or a shortened life expectancy, focusing on symptom management, functional ability, and quality of life becomes paramount. This nuanced approach is at the heart of personalized geriatric care. I hope this discussion has given you a clearer roadmap for navigating the often confusing landscape of senior health screenings. Remember, the goal isn't to abandon care, it's to refine it, to make each test purposeful, and to replace unnecessary procedures with empowering habits that keep you thriving. If this information resonated with you, please give the video a thumbs up and share it with friends or family members who might benefit from a smarter approach to health after 70. Your engagement helps the algorithm bring this message to more people who need it. And if you haven't already, consider subscribing so you won't miss future videos where we dive deeper into topics like medication day prescribing, brain health exercises, and how to create a home environment that supports safe aging. Finally, I'd love to hear from you. What screenings have you questioned lately? Have you already started a conversation with your doctor about scaling back, or are you still gathering the courage? Drop a comment below and I'll respond to the most common concerns in an upcoming Q&A. What experiences could help someone else make a better choice? Stay curious, stay compassionate with yourself, and remember that true health is not measured by the number of tests you undergo, but by the richness of the life you continue to lead. Until next time, take care of your body, nurture your mind, and keep the conversation with your healthcare team open and honest.